Indiana lawmakers are just weeks away now from considering new abortion restrictions. And while we all wait to find out what they may be considering, some doctors right now are concerned about the potential impact on cancer patients.
So tonight, Rachel Kraus looks into the complicated situation.
It's something that not a lot of people think about necessarily because we have these images in our minds of the happy family at the time of delivery and a healthy mom and a healthy baby. But pregnancy can be very dangerous for people.
As a maternal fetal medicine physician at IU Health, Dr. Carolyn Rouse works with pregnant women every day. She says the risks of health complications and death for a pregnant woman are much higher already than women who aren't pregnant. And for people with pre-existing conditions like diabetes and hypertension, pregnancies can be dangerous.
We know that the complications inherent to pregnancy, even for people who are low risk, are much greater than the risks associated with the first trimester termination of pregnancy.
And for women battling cancer, pregnancy can be serious.
Things like timing of when the diagnosis is made, the trimester, the types of chemotherapeutic or radiation therapies that are recommended, some of those can't be done in pregnancy, and so can significantly impact a pregnant person's long-term mortality risk from that cancer, particularly if they do not get adequate treatment on time.
And cancers that require radiation can be particularly problematic, Dr. Rouse says. It's why any woman, any family going through this needs to have every option presented to them.
These are some of the hardest conversations that people can have. Really, nobody gets pregnant and expects to be confronted with a diagnosis of cancer, which is so devastating for the pregnant person and their family and their friends. And then having to make a decision about, risks of continuing versus ending the pregnancy is just devastating.
Dr. Rouse says these are not easy choices to make, made that much harder now that the Supreme Court has overturned the constitutional right to abortion.
I'm often part of the worst day of somebody's life when you have to talk about these things, continuing a pregnancy and potentially risking the life of the pregnant person versus ending a pregnancy. And the stigma and the judgment and the lack of access to all of the options makes it 1,000 times worse.
With lawmakers in Indiana set to meet in a few weeks to discuss a potential ban on abortion here, Dr. Rouse says she worries about the impact a ban could have on families and the potential of pregnant women dying.
It's really about choice and each patient and each family's ability to choose what's best for them.
So that special session here in Indiana is coming up on July 25th. So 13 Investigates sent out a survey to all 150 state senators and representatives to find out where the lawmakers land on the issue of abortion. We asked 5 questions. We wanted to know if they support a complete ban on abortion or if they favor more restrictions with exceptions for rape, incest, and life of the mother. So far, only 11 lawmakers responded. 0 GOP members answered. But a political scientist told us that may be part of a larger strategy.
Coming out as being one of the few legislators on the record at this time where there is national and international scrutiny, as well as statewide scrutiny on what the Indiana General Assembly is doing, does have some risks for those individual lawmakers.
If you'd like to see the survey and the responses received as of tonight, just go to WTHR.com/investigates.